Certainly. Let's discuss the significance of the rheumatoid factor, RF test, in the context of musculoskeletal disorders. What is rheumatoid factor? Rheumatoid factor, RF, is an antibody that can be present in the blood of individuals with autoimmune diseases, particularly rheumatoid arthritis, RA. RF is produced by the immune system and targets the body's own tissues, leading to inflammation and damage, especially in the joints. The RF test measures the level of these antibodies in the blood, helping healthcare providers assess the likelihood of certain autoimmune conditions. Indicating rheumatoid arthritis. One of the primary uses of the RF test is to help diagnose rheumatoid arthritis. In individuals with RA, RF is often found in elevated levels, though it can also be present in other conditions or even in healthy individuals. A positive RF test, combined with clinical symptoms such as joint pain, swelling, and morning stiffness, can strengthen the diagnosis of RA. Understanding the presence of RF helps clinicians categorize the type of arthritis and determine the most appropriate treatment strategies. Differentiating conditions. RF testing is also valuable in differentiating between various musculoskeletal disorders. While a positive RF test is most commonly associated with rheumatoid arthritis, it can also be found in other autoimmune diseases, such as Sjogren's syndrome and systemic lupus erythematosus, as well as in some chronic infections. By evaluating RF levels alongside other clinical findings and laboratory tests, healthcare providers can better distinguish between these conditions, which is critical for effective management and treatment. Monitoring disease activity and treatment response. In addition to its role in diagnosis, RF levels can be useful for monitoring disease activity and treatment response in patients with rheumatoid arthritis. While RF itself is not a direct measure of inflammation, changes in RF levels over time can provide insights into disease progression. If a patient's RF levels decrease after starting a treatment regimen, it may indicate that the disease is becoming more controlled. Conversely, persistently high RF levels, despite treatment, may suggest that the disease is still active or that the treatment plan needs adjustment. In summary, the RF test is an important tool in the evaluation of musculoskeletal disorders, particularly rheumatoid arthritis. It aids in diagnosis, helps differentiate between various conditions, and can assist in monitoring disease activity and treatment effectiveness. Understanding the role of RF will enhance your clinical competence in managing musculoskeletal conditions effectively.